Your health diagnosis has gaslit you. Today, we're talking about PANS, PANDAS, and Lyme disease.
There you go. You got it. Lyme. It's not limes. It's not what we eat.
Right?
You got that, Terry? Okay.
Yes.
We go talk about that. We got a little story with that one already. We have a very special guest today that I want to introduce with us today. We've got Dr. Eboni Cornish. I'm going to read a little bit about Dr. Cornish. She gave us one hell of a bio. So I'm going to, and it's good. I mean, it's good. We're gonna pull out the things, and if I miss the things, Dr. Cornish, you let me know, okay? So we've got an Amen clinic physician here, which is so cool. All right, Dr. Cornish. She is a very highly regarded physician. So adjust the crown. That's right, lady. She does a lot of integrative medicine. She works with a really diverse community. She is the functional medicine director of the Amen Clinic East Coast Division. She specializes in the autoimmune diseases, Lyme disease, environmental toxicity, gut imbalances. We've got the neurology, various other chronic conditions. She has a holistic approach, which we may or may not love here at the Gaslit Truth Podcast. And Dr. Cornish identifies root cause. So yeah, let's look at root cause of health issues within biological systems of the body. So she works with kids, she works with adults, and she has developed the neuroinflammatory intensive program, which is a 2-week inpatient initiative that looks at neurological complications from these chronic infectious diseases, mold illnesses, chronic inflammatory conditions, and does the brain imaging along with that. And so that is really, really cool. She works with Amen Clinics too, because she is also an expert in SPECT scan analysis, which I'm sure we are going to talk a little bit about that today. And then education-wise, she earned honors at Brown for undergrad studies in her medical degree from Brown Medical School, and family medicine residency was part of that at Georgetown. She, as a medical fellow, conducted translational research for National Human Genome Research Institute. Wow, worked under Francis Collins, and is the treasury of the board for the International Lyme and Associated Disease Society, which is way cool. We're going to talk about that. And Dr. Cornish is honored as Northern Virginia's top doctor for family practice in 2021 and 2022,
Nice.
and recognized by the Continental Who's Who as an exceptional woman in healthcare. Wow. I would like to welcome to the show Dr. Cornish.
Oh my God, you made me seem so smart.
Well, yeah, just that crown, lady. I'm just saying, like,
thank you. I am so happy to be here to just get it rolling. I mean, I've been excited ever since you invited me.
Yay.
So let's get it.
Get ready
Yeah,
for
so
the
I want to clarify because
because
I saw Dr. Cornish's face when Jen said we may or may not love holistic, and I'm like, we love it.
Yeah.
We love it.
Yeah, we pretty much
She was
hate
being
everything
facetious.
that's not that.
Yeah.
So good thing you're on the right show.
Yeah.
There's one thing you missed is mama triplets.
Oh,
Yeah, that's
right.
not on this
Have
list.
a
Should be at
puppy.
the top.
Yeah, we got a Christmas
that's-
puppy coming, so like
Oh, jeez.
mama quads coming soon.
Oh my! How old are
Coming
you?
soon.
Three of them the same age.
2 girls and a boy.
Oh my gosh!
Holy
One
moly.
and done, man.
I guess.
Oh, that makes sense.
She's
Yeah.
efficient. She's also
Yeah.
very efficient.
She's-
Yes.
Top skills, efficiency. Put that on the
Yes.
resume. Ding.
Exactly. Love it. All right. So today we're going to get started because I have a curious, inquisitive, I don't have this as my own special interest, for PANS, PANDAS, and Lyme disease. And Dr. Cornish and I met at the IMMH, and I was like, what would you like to talk about if you came on the podcast? And she goes, everything. And I went, well, we only have an hour, so
we can do it.
I would love to talk about everything. But these are the things, because I think these are some of the hidden points of your health, and also particularly with Jen and I in your mental health care. Because we've seen it, we've spocked it out in our own practices, but I would love to learn a little bit more about these things, and maybe a little bit what to do if you suspect that your child or yourself might have these. Plus, we're also in Wisconsin. I don't know if she knows that. And Lyme disease is kind of a big deal around here,
Yes,
and
it
it's
is.
often dismissed a lot. So love to get into that. So what would you like people to know about PANS PANDA?
I mean, it's a disorder that's missed so often. And it was first classified in the 90s by Dr. Suedo, who did an NIH study about 50 kids where these kids had OCD overnight. You know, no explanation for it. just my kid changed overnight. And basically, these infections, I mean, it can be strep throat. The next day, your kid is a different kid. And that can be from OCD to ADHD to even, just having problems with handwriting or going backwards with development all the way to kind of bedwetting again. And the list goes on and on, anxiety, depression. But then you don't recognize who they are. And so that's the associated with strep. And then we have PANDS, which is pediatric autoimmune neuropsychiatric syndrome associated with anything and everything infectious, right?
Oh,
And
I didn't know
this,
that. I did not know
yeah,
that
so you
part.
have so
Okay.
you have the one associated with strep throat, and then you have just the syndrome, which can be from Lyme disease, mycoplasma pneumonia, chronic viruses like Epstein-Barr. We've seen a lot more with COVID, since the pandemic. A lot of kids post-COVID are having this condition. So, yeah, so it can be associated with more than just strep, but it's basically an overnight change.
Okay, so that's the interesting piece of this. So when you say overnight change, it's a fairly quick noticed, but it's a quick thing, right? Like when you say quick, define that. Is that
I
something
mean,
like overnight or within a week or two? I mean, there's just major change in behavior.
Jen, you said it all. I mean,
Okay.
most doctors don't know. It can be all of the above. Commonly, the patients I see will tell me, "Oh gosh, I didn't recognize that my kid was having obsessive patterns or OCD or problems with focus immediately."
Okay.
Sometimes I'll see people like, "Who is my son?" The next day he woke up after this fever breaking stuff like you just said, or just being angry and defiant when they were nice and sweet and calm. So it can range because you have to determine when the changes occur, and it's hard to figure that out, right?
Mhm.
The kid is
Mhm.
just being fussy or irritable or normal kid stuff, or if they really have an underlying psychiatric and neural inflammatory process.
Right. Right. Yeah.
So
And
I'm
oh,
yeah,
go
well,
ahead, Terry.
I'm giving a little thought to this because what happens then if well, also I have so many questions. I'm going crazy in
You
my
gotta
mind here.
organize your shit in
I
there,
have to
lady.
organize my mind.
50 minutes.
So also like outbursty behavioral things like
Mhm.
tantrums and stuff like that. Did I hear you say that correctly
Oh
too? Like
God, yes. I mean,
okay.
like every day, I'll never forget one of my first PANS cases. I knew the mom very well because the mom
Mhm.
had Lyme disease, and she would bring her cutest 6-year-old son to every visit. He was so nice, so sweet. And then a couple visits into it, she was like, "Oh yeah, he's been ill. He got sick. I can't come to my appointment." The next week she came. That boy was throwing Kleenex. He was kicking the table. He was hitting her. And I even recognized, I was like, yeah, you need to get your son tested for PANDAS because I know him. I've seen you for a very long time, and
Yeah.
this is different.
Yeah. So what happens though if they don't get tested and things for this? Like what happens then?
It can get worse. I mean, it's an autoimmune process. So basically, the way I always think of autoimmune is there's something nasty going on in your body. May that be bad dieting, an infection, whatever stress, and your immune system becomes like a hair trigger and
Yeah.
it starts to attack your cells. That's autoimmunity. And this is an autoimmune neuropsychiatric. So just to break it down, it's an autoimmune process that's happening in the brain
Right.
of these patients. So if you don't fix it, you're going to get worsening of this autoimmune process. Your immune system is going to get all crazy and stupid and start attacking any and everything going on in the body. And I call it ANDAS, adult onset, because you don't have to be a kid for this.
Thank
Yeah.
So
you.
they just
Yes.
continue with it down the
Okay.
road and it gets
Well,
worse.
and that's where we have seen this come
Mhm.
in our practices. because it wasn't like what you're describing. If you didn't have awareness of this, okay, what you're describing, these behaviors, if I were a parent, I would go, okay, psychologically, something's wrong with my son, right? So maybe he's got ADHD. Okay, we're going to start putting these labels on, right? As a parent, if you don't have an understanding of this diagnosis, right? So when your child starts acting like that, or their oppositional defiance and all these labels, that keep changing when the damn DSM and ICDs keep changing, right? Okay. But I know,
Yeah,
right?
thank you.
You should have been on the episode where we burned ours. It was fabulous. You probably would have loved it. But I think about this as a parent, and I would be going, I've got to get my kid to a psychologist. Right. So, or I've got to get my kid to a therapist, because there's such a psychological component to this within the behavior change that is outwardly seen, that if you're a bit naive to this, or you don't have the awareness of other things this could be, you're sending your children to psychologists or psychiatrists for many years to work through these symptoms. And then on the back end, this is what Terry and I have discovered. Then as adults, they come into our practice. And we're catching these things as we go back through the medical history and start asking the questions about the illnesses.
Yeah.
Was your child sick? What types of
Yeah.
things did they struggle with? And that's the stuff that pops, because I think that as parents, if you don't have awareness, right, you go, well, it must be a mental health issue. You send
Yeah.
them to a mental health provider.
Well,
I don't
because
know if you
everything is a mental health
see
issue
that
these
too,
days.
but
I see that every single day, probably multiple times a day.
Yeah.
Because, and then what happens, what you forgot to tell, the listeners, is that they go through all these psychiatric meds and therapy, and it does not work.
That
So
actually
then
makes it
I'm
worse,
meeting
probably.
a patient who's been on, antipsychotics, antidepressants, hospitalizations since as a young child, and
Yeah.
failed everything. And that's
Mhm.
one of the first questions I ask, especially if people are under 30. It's, hey, did you ever get strep throat as a kid? And another thing doctors need to ask is for mothers, especially sometimes because they're with their children, no matter how old the patient is, did you have to take antibiotics during pregnancy? Because group B strep, which is something we get screened for during pregnancy, has also been shown to be a contributing factor. So I see parents tell me, oh, moms will say, oh yeah, I had that strep thing. And yeah, I've seen, changes. He was very delayed. He was always a hyper kid. He was always a moody kid, even from the younger ages. But that's another great screening question. Not only did they have strep throat as a child, or people might say, I don't know, and say, did they take antibiotics as a child?
Yeah.
That's always a red flag. And mom, did you take antibiotics for strep during pregnancy?
So that could be a contributing factor as well from the mother's end.
Yeah. Yeah.
That's really interesting. Something that I'd never really thought of. And so I'm thinking about someone that we had who had tons of infections. They had mono. They had what else, John? I can't remember the other stuff. Strep throat, all the
Yep.
things. Then it was
Yep.
delayed for a few years, like nothing really happened, and suddenly they had another infection, and things went haywire.
Okay.
And things went haywire in the early 20s.
Yeah. But the behavioral things were there so much earlier, right?
Yes, but they
Throughout
were
high
able to
school.
manage through
Uh-huh.
all of that stuff,
Mhm.
until this point in time after the most recent infection. So most of people think about this for children, like young children. And so it gets very, in my opinion, I've seen it get dismissed as soon as you hit, as soon as you're 18, 19, like suddenly you can't have these anymore. And so
Mhm.
you're saying that you can, and can it be onset at an adult age too? Or is it mostly onset in childhood and then you figure it out in adulthood?
So you answer that question exactly, because you said that person who you referred to, they had, may have had strep at a younger age, and then your immune system is very robust, because what happens with these infections, they cross the blood-brain barrier. They
Yeah.
go into the actual brain,
Yeah.
and that's where they kind of wreak havoc and start that autoimmune process. But everyone is different. You can be a completely healthy, optimized immune system. You can detox. never been in a toxic environment, never get another infection, just great, wholesome diet and attitude about life and exercising, and you're good. You may not get a flare up, but just like you said, you get another superimposed infection. You may have other causes of inflammation in your body, maybe not eating right, or immunocompromised for other reasons, environment, etc. And then boom, it flares back up.
Yeah.
It's kind of like the analogy I'm starting to use with my patients, which I think is pretty funny and cool and makes sense, is that some of these other infections, like if your immune system is compromised, it's kind of like Michael Jackson in Thriller, right?
Yes.
That new infection wakes up all the zombies that you may or may not have known existed. They start dancing around the body, and then you're scared. Exactly. That's exactly
Oh,
what
it's a great. I love that. Okay, we're gonna use that when we have patients that might be dismissing the idea that this is a thing for them. That's a great analogy to actually talk about, because that's what the parents describe happens with their kids, and even when they're older, right? Like, this is our patients we get are the older ones that the parents are concerned.
Yeah.
It makes
And they
me
actually-
wonder how many kids and adults are misdiagnosed and should be looked at differently. I did see an Instagram post that you had just this morning, and I don't know when you posted it. It just came across my feed, and I think it was about ADHD, and you said basically uncover everything else first. Don't make medication your first priority. Make other things like diet. Could you expand on that a little bit in this context as well?
Yeah, and it's very important, because the one thing I love about working at the Amen Clinic is that we look at mental health as brain health. So
Yeah.
all the doctors I work with who might be psychiatrists, the reason I got on board is because they would send me brain scans and say, hey, this isn't psychiatry. I mean, it's more than depression. It's more than ADHD. They can't focus and they can't tolerate any of these pills I'm giving them or any of these other methods. There may be something else going on. And so, that's Dr. Amen. I work directly with him as well. It's like, what else? And I put on my detective hat and I go digging. And I'm like, well, let's look at this brain. Maybe it's something else inflammatory. Maybe they can't focus because they have sleep apnea. Boom. Did you rule out your kid can't sleep? Maybe they can't focus because their hormones are imbalanced. Did you rule that out? And then maybe they can't focus because they're in a water damaged building, or they have this McDonald's diet that's really high in inflammation,
Yeah.
sugary diet, and they're wondering why, you can't focus and you can't either.
Yeah.
And then you look at the bug. So I always, when I see a patient, I start with looking at hormones and sleep. That's huge. That's going to affect everything. Then we do talks about gut and diet, because the gut is the second brain. That's like, I'm so passionate about gut health and holistic diet and making those changes, because that's going to mess your focus up if the gut is connected to the brain, right? And you're eating foods that damage your brain. Of course, you're not going to focus. Then we're looking at hormones. And then we're talking about all the toxic stuff. Like, hey, did you live in a water damaged building? What about that, metal in your mouth? Did you have metal amalgams? You got some fillings going on? So I started thinking about different toxins that can play a part in just this inflammation. And then we talked all sexy about the bugs. Then we started talking about, the strep and the Lyme and the co-infections and parasites. And that's why when you ask me what I want to talk about, look, I love everything.
Sexy bugs. That's what she wants to
Sexy
talk about.
bugs.
Sexy bugs. It's the sexiest bug ever. I love it.
Let me ask you, so on those spec scans, can you can pick up inflammation, or you can pick up, like, it's just a piece of the puzzle? Like, what can you pick up in relationship to this topic on a
Oh
spec
my
scan?
I love spec scans. I love them.
I'm supposed to go get one, Dr. Cornish. So
No.
is Terry. We're
No.
we were supposed to go to Chi-Town and get some spec scans done. So we got to get on that.
I'm a fangirl of spec scans, and I've always been. Like, when I've been collaborating with the Amen clinics multiple since 2011, right? We weren't doing, this was before Dr. Amen came out with memory rescue. So no one really thought of the clinics as being more functional. But I just know they are smart. They're smart. And I have my private practice. I'm like, okay, we got these pretty colors with holes in their brains. And ooh, this is nice. When I was in my private practice, I'm like, okay, this doesn't look normal. They showed me what normal looked like. Then I saw abnormal. And I was like, oh, okay. So now I use SPECT scanning almost all the time because I got trained in it, because I was so fascinated. I was like, I need to understand this like the psychiatrists do, because in my PANS patients or my Lyme patients, we can rule out other things. That's why I love it. So it's definitely, it's a 3D image. Okay. So it's completely different from an MRI or a CT scan, which the majority of my patients have had already, because they've been seeing like 3 and 4 doctors before they come to my doorstep. And it tells what part of your brain is too active, what part of your brain is not working well enough, what other type of underlying, if there are like trauma or ADHD or depressive patterns. And then the coolest part is it looks at these inflammatory processes that might occur by looking at, something called parietal lobe, which is the top of the head, right? And then you look deeper and you might see, oh my God, this person's brain is on fire. So there are areas of the brain that are overactive. And you're like, oh my God, this is so awesome. This is why this person is ill. But then the even cooler part about SPECT scan imaging, and I encourage, it's not mandatory for my patients, but with my 2-week program, I've had patients who've been frankly psychotic, who've traveled to see me, like been inpatient. And the coolest thing about the scans is that you can rule out other things that might be going on.
Yeah.
Like a traumatic brain injury that you didn't know that you
Was
hit
even there.
your head. You forgot to tell me about that car accident, and it's on top, it's layered on top of the inflammation. So that's why it's like change. It's always been a big part of my practice, because they sent referrals to me, but now I'm sending referrals to them.
Yeah.
And,
Okay. And the SPECT scans, they're looking at it. This is about blood flow to that area of the brain.
Blood
right?
flow and activity. So
Yeah.
it's
Okay.
like how active your brain is.
Yeah.
Yeah.
And so
so
why
yeah,
is that
it's huge.
important to measure blood flow to the area of the brain?
Because if you have decreased blood flow, that could be a reason why you might be suffering from that brain fog or that chronic infection, because you can help heal that, like brain cells, they can, get healed. We're not like Lazarus. Once your brain cells die, they're dead, but we can help to revive them.
Yeah.
And there are things you can do if you focus on that, like, N-acetylcysteine, like hyperbaric oxygen, like sauna, and getting people to just exercise. And that will lead to generation of new blood vessels.
Terry's always saying that to me. Go get your ass in a hyperbaric chamber.
Love it.
I'm like, yeah, I probably should.
I
Yeah.
am a big, look, I fangirl about that too.
I know. I am too.
She got one in her house. It's fine. The kids are down there fucking around with it right now. It's fine.
I think we underestimate hyperbaric oxygen. Would you like to speak on that a little bit, or is that?
Oh my God, yeah.
Yeah, that'd be
Go ahead.
cool. Yeah.
I told you, whatever you want. Okay.
I'm fangirling over you right now. I'm like, give me all the juice. Like, that's all I
You
want.
ready? You ready?
Yes.
Okay. So before I joined full time with Amen Clinic, I was a partner with someone, and we owned, hyperbaric chambers that were hard shell chambers.
Told you, you got one in your house, don't you?
It's so awesome. So things that happen, you will hear about a lot of athletes. And I know, Michael Jackson slept in one. And, you might think, oh, that's too, bougie for me. I'm not going to do it. But let me tell you something. It's going to increase blood flow to areas of the brain that might need it. It's also going to help you regenerate new cells. It's going to increase blood flow to areas of your body that might need it. Like that's why they use it in wound healing, right? Because it helps with cell regeneration and blood flow. That's why we use it in strokes, because it helps regenerate new blood cells and nerve cells. We use it in decreased blood flow, concussions, injury, because of that same mechanism of action. But then it gets even cooler because it improves your immune system. It helps you with detox. There are papers that show hyperbaric, low pressure, and benefits from mold toxicity. And it kills bugs. So there's a lot of research showing this antimicrobial effect,
There you
right?
go. Yeah.
For Lyme and co-infections, but specifically the paper was published on Lyme, Borrelia burgdorferi, that it went in there and it has some impact on killing these infections, which is amazing.
That is amazing. So my son played college football, and when he was done playing, he was resistant to doing hyperbaric chamber or anything the first 3.5 years. And then the fourth year, he had a mild concussion, but I know all brain injury is brain injury. I'm sure he had more, throughout the course of time. It would be impossible to not. But I literally threw him in a hyperbaric chamber. I'm like, this is the time you're going to go in here now. Now you're done playing, please do it. And he willingly went in and did multiple sessions in hyperbaric oxygen. So from that point on, I'm just like, everybody, I'm putting it in the parents page on the football, like, get your kid in a hyperbaric chamber. Like, please just do this for them, like for their future. Like, you've got to consider this. You have to consider the health of their brain moving forward, and I know people, the whole football thing is very controversial. Sports are controversial. But at least take care of the health of your brain if your kids are going to be playing sports. So that's the bottom line for that. So can you expand a little bit? You mentioned Lyme disease. We have a lot of Wisconsin listeners. And
Yes, we do.
could you explain what Lyme disease? Yes.
Boom.
Lyme disease.
You
I've said
got
it so
corrected
many
before we
years.
started. It's
We did.
Lyme
I've said it like that
in
so
the
many years.
coconut.
Yes. Can you explain how that might present in someone that they should get curious about getting tested, and what that test would look like for Lyme disease?
All right. So this is where it gets tricky, right?
Mm-hmm.
Because there are so many nebulous symptoms associated with Lyme disease. And when we say Lyme, we should think about it as vector-borne illnesses, because there's something called co-infections that do their own thing.
Yeah.
And those are terms that people might be aware of, like babesiosis, which is a tick-borne parasite, or Bartonella, which is another infection that lives in the red blood cell. But there are others like Rocky Mountain spotted fever, just to name a few, just to give some flavor, because there are tons of bugs out there that can be transmitted by these ticks, these co-infections. And honestly, when you first, like, less than 50% of patients recall ever having a tick bite or a rash.
Mm-hmm.
That's the majority of the people I see. I rarely see a patient come in the office and say, oh, look, I got a tick bite. But a lot of times what does happen when they do get those tick bites, they go and they may not get sufficient treatment, right? Because as ILADS, I'm treasurer, and our organization, we publish guidelines and we say, hey, look, that one day of doxycycline may not be enough. These organisms can reactivate, like we talked about earlier, when your body is under stress. And Lyme is the most, popular Michael Jackson there is, because it flares up everything.
Yeah.
And so you're at home, maybe a little fatigue, you're not remembering things like you used to, you're getting fevers randomly. That can be the initial step. That's where I hope to catch people when they're having fevers and just a little brain fog and memory problems in that early stage. But you have to remember, there is no guideline that says official treatment, but our recommendations as ILADs is usually 30 days minimally. Okay. Most doctors treat a lot longer. We're sophisticated enough in our field where we have MDs, NDs, and other doctors who might be using more integrative strategies for tick-borne illnesses, but minimally 30 days, not that one day, because it might reactivate later, even with 30 days of management. And you go to, and it affects all those areas we talked about earlier, the hormones. They even have Lyme can be in your gut. It is a toxin. It makes your response to other toxins even worse. And then you start going around your life, thinking it's behind you, get another stressor, get older, go through menopause, go through puberty, COVID, Epstein-Barr, the list goes on and on. And that infection that was in remission flares back up again. Yeah. And that's where it's a little more serious. And that's who I see. I typically see the patients who've already had that initial workup and they're coming to my office now with like asking to be on disability because they're having dementia-like symptoms. And I forgot to mention in both stages, you can have this, migrating joint pain. And typically, if you think about flu-like symptoms in the summertime, because who gets the flu in the summer? Those are some other clues, as well as the people who are lucky enough to get that rash. I mean, that means they can catch it earlier. So red bullseye rash anywhere on the skin. So second step, you're appearing and you're like really debilitated. I mean, I'm talking about numbness, tingling on your soles and feet. I'm talking about, lack of sleep, impairment. I see people who've been misdiagnosed, honestly, with multiple sclerosis and Parkinson's. And we do some deeper digging and we find out, in fact, it is tick-borne illnesses. So it can be that severe. So it's all over the spectrum. But the thing is, like we talked about earlier, you're going for treatment for other things. I feel dizzy from lying to standing. That could be Lyme. It's been published. Oh, wait. I can't get better with my cardiology with their treatments. And then it goes on and on. Oh, I have a headache, but migraine medicine doesn't work. Oh, I'm cognitively impaired, but dementia meds don't work. And then, stimulants don't help me get better with my energy. And it's a long list of symptoms. But I always tell patients, don't think you need to have a tick bite or a rash. Don't think that. And so then you get into all the drama when it comes to the testing.
Yep.
Yeah, there is a lot of drama here.
Oh,
I do know this. Yep.
So
Go ahead.
sad.
Bring it out.
So sad. The National Institute of Health, they recommend that if you don't have the 2-tiered testing system positive, and that's what we call a screening, and then enough of these antibodies, then you don't have Lyme disease. You don't have Lyme. What we find in people who believe and understand chronic Lyme is because these tests you might see, this IgG and IgM, that depends on you having a robust immune system to mount a response. And on top of that, most people with Lyme disease are immunocompromised in the first place. So they're less likely to have a positive reading. And then you layer on top of it that the standard tests suck. LabCorp and Quest, they miss about 60% of patients. That's why you have Lyme doctors on Capitol Hill advocating, each state trying to pass legislation. And Virginia, we passed legislation whereby a doctor legally can't tell a patient that they don't have Lyme disease based on results alone. That's legislation. I mean, we don't arrest people who do it, but we should
Lyme police
save a lot of lives. But yeah, so people in every environment, they're fighting for it. I know Illinois near you guys has a great Lyme association in the Midwest, but it is. And then when you get to the more sophisticated testing, that's when it gets harder because a lot of them aren't covered by insurance.
Right.
Right. That's the
Yeah.
problem with a
And
lot of this
people
stuff.
are like, I'm
Yeah.
not doing it. I don't
You
have
can't do
Lyme.
it.
I don't have the money to pay for these more expensive
Yeah.
tests, knowing that they are better tests because they are more sensitive than Quest and LabCorp. And
Yeah.
that's what I always tell patients, like, hey, especially if you have Medicare rather, there are free, more sensitive testing that you can have done for free with certain Medicare plans. And if you need those answers, there are testing for every budget. Some test companies take partial payments or care credit or Klarna and all those things out there. But if you think it's very important for you and your child, missing it is very detrimental.
Yeah.
Because it can lead to terrible, terrible results.
So one of my my uncle and his daughter both had Lyme disease. And she ended up in a wheelchair for a while
Yeah.
in high school. She was a soccer player, ended up in a wheelchair. And because, traditional medicine failed her, right, to these points, finally she got into a Lyme doctor, and so did her dad. And then they began their journey of recovery, and it worked, so I think underestimating the power of Lyme disease is detrimental to public health. I'll just say that out loud. And also, I was thinking about someone that I know who had Lyme disease and then got better. I'm air quoting if everyone can see that, got better. And a couple of years later said, well, I caught it again. And now I'm like, wait, it never went away.
Right.
It just reflared, like you're saying. Yes.
Yeah.
So I'm like, to me, that was very interesting to hear that if you catch it again, it's likely that it was never gone in the first place. It's just dormant for a while and a reflare, likely due to improper treatment.
Yeah.
Yeah.
And it's so
Very.
sad. It happens every single day. I'll never forget, I'm originally from Detroit and my residency was in the city, Washington, D.C. But when I was at med school, I saw my first exposure to a Lyme disease patient. It was a landscaper. They had that tick bite and rash. And my attending, sorry to shout them out, but they said, oh, give them 1 dose of doxycycline. They're good. He came back the next week saying he wasn't feeling better. And she was like, okay, give him another 1 pill. He'll be good. The 4th week he came by, I'll never forget, she told me he was drug seeking. She was like, don't give him any more antibiotics. There's
Drug
no
seeking and
way.
antibiotic.
Drug seeking an antibiotic.
As if it
He's
makes sense.
already had 2 doses of doxycycline. That's ridiculous. He's probably going to give it to his family, all kind of things. And I'm not exaggerating. So from that
No,
point,
I know you're not.
from that point only, I was like, okay, they all drug seek. I don't
Yeah.
believe in
Yeah.
Lyme. And so even some of my med school colleagues and friends are like, why are you doing that voodoo medicine? Like, give them a dose of doxycycline and get them out your office, or they're
Yes.
crazy. And that's why so many patients are diagnosed as crazy and anxious, and it's just insomnia. And it goes back to like what you said, Carolyn, when you were talking about the kids. They're getting on all these meds. The same thing with Lyme patients, and they don't get better because you can't treat Lyme disease with an antidepressant or antipsychotic or stimulant. You can't do it.
Yeah.
You can definitely make somebody worse by doing that, though.
Yeah, I was gonna say you're actually you're probably creating a synthetic brain injury that maybe wasn't there in the first place by giving them that as well. Yeah, when you think about that, especially when they're younger, I mean that's essentially what some we have opinions on psychiatric medications here on the Gaslit Truth Podcast. Not that I have one, but I do. And so then you're adding this in, right? Sorry, not sorry. Like no, I'm not. You add this into the to the mix, and you're not actually, again, when you're talking about root cause, right? We're just layering layers of shit on top of things that are then changing the neurological makeup, especially of kids, right? When the full development is in their 20s when we're getting through this, right? They've messed that up. There's an injury to that now. You've changed probably some of the other immune features of the body, because we're talking about neurotransmitters, right? They are through the entire body. So you've added a whole nother layer of problems, right? And then you got to dig through all that at some point when they're flaring up again, or when they're
And
older,
figure
or,
out how to get people off those medications
and
safely
then
and
try to
get
get them
them.
off of it.
Yeah.
Yes.
And you can't really get them off of it if you don't treat the root cause. And that's why I love working at Amy Clinic, because the docs all the time, we work on getting people on herbals and off these toxic psych meds that they come into the clinic with. And especially when I'm working with them, I'm like, look, my only goal, if this is really neuroinflammation, which I think it is, I want to get you off these other meds. I want to treat the root cause. And sometimes it takes a long time, because these medications can have so many side effects when people are going through withdrawal. And it's like a Band-Aid to their real symptoms. And some people, that side effect, they think the symptoms came back. But in fact, it's like you said earlier, those neurotransmitters trying to stabilize when you remove something that's falsely supported them.
Yeah.
Yes.
Yeah, for sure. I could imagine you guys having to really dig through multiple layers of shit when you look at this, right? Because it's there's an impact that happens from even when you were talking about, can you speak to us a little bit about so the treatment for Lyme, when you were talking a little bit about this and the antibiotics that are utilized, okay, and the course of antibiotics, okay, can you talk a little bit more about that? I'm just wondering if you have any opinions on that too, especially when kids are younger, because we also know that if the antibiotic is going to help, get rid of these damn sexy bugs, the other issue though is there's also residual impacts that can happen over time over too much antibiotic treatment.
Oh yeah.
Okay. Can you speak to that?
Of course.
Okay.
And you have to support the gut during this process.
Okay.
Antibiotics are a gift and a curse, right? I try in my cases to have that get in, get out mentality. Like, okay, look, I know that there's room for this and there might be a need for this, because I understand, even when I train physicians, because I'm a part of our Lyme physician training program, I say, look, you need to understand the basics. The basics, 30 days, it may or may not be enough. Then start layering on those herbals and other integrative treatment options. And I think most Lyme doctors out there today understand that. They kind of want to see how, depending on how severe a patient's symptoms, because like I said, if they're presenting with multiple sclerosis symptoms, right, or in a wheelchair, it may take a lot longer with herbals alone. So I think there's beauty in combining both of them when you need to, and the patient's case is that severe, but at the same time you're taking the gut. But I also see value of trying to transition to more of a herbal only approach, so that you're rebuilding a person, you're not getting resistance, but you still have the ability to kill that microbe, that organism.
Okay.
And so I'm also thinking about PANDAS here with this too, because they're people that have been through lots of antibiotic cycles and things like that too. So can you speak a little bit more to treatment recommendations for that?
Yeah, so a lot of times it depends. Like, remember we said it can be strep throat, or it can be a lot of other bugs as well. I always, with my PANDAS kids, I support the inflammation, because remember, this is autoimmune. So I'll do things, make sure their diet is optimized, they're off the gluten and they're off the sugar, making sure I give them things. One of my favorites is what's called SPM active, which is a special resolving kind of, it's a derivative of shellfish, but it's very, very good at decreasing inflammation. I also give my kids like broccoli extract. There are different types. So forfane, which is great at supporting immunity and decreasing inflammation. And then, making sure I do optimal detox before I look at some of my favorite killing agents. So as far as herbals, I love Japanese knotweed. I'm a big fan of berberine. I love an herbal called cryptolepis. Fantastic. And then there are companies out there that make herbals for PANS and PANDAS that can includes multiple agents. There are certain companies out there. So I use a diverse amount of agents based on what the primary infection is and how my patient responds. Now, if they're coming in my door and they got severe gastritis and they can't tolerate foods and this, I might in that case start with a gentler herbal approach as I work and heal their gut and see what happens. Some people do better on herbals alone. You just don't know.
Is this a different approach than traditional medicine would take?
Oh, of course. Of course. Like I said, oh yeah, you know that.
Yes, I do, but our listeners don't.
Yeah, they would give you that one dose of Doxy or those 2 weeks and tell you to go away because it's post-treatment Lyme syndrome. And they would
Or
say
for
Lyme.
PANDAS,
They would say
PANDAS too.
Lymes, and they would say pandas, and they would say, well, I don't know what that means.
Oh, I was saying pandas too. There's no S on
That's
pandas.
right. That's right.
Oh, okay.
That's right. But you can also have pans.
Oh my gosh.
So everything is not associated with strep. You got that one.
Right.
It is
Okay.
pandas.
Okay.
Let me clarify for the listeners. She is absolutely right. There is pandas, but the AS is associated with strep. And sometimes people get that strep test. Doctors will say, oh, yeah, you don't have it. But there are 2 antibodies, ASO and anti-DNase, that if your doctor checks, will tell you have chronic strep in the body. And that's a complete game changer. Or, traditional doctors are like, oh, you don't have strep throat. Why are you here? So that's associated with strep. But then when we're thinking about PANS, that can be anything, like we mentioned earlier. So people might look at the strep and say, okay, that's fine, and not think about the PANS, the other infections like mycoplasma pneumonia, like Lyme disease and co-infections, like chronic viruses, just to name a few.
Even ear infections, would that be part of it too?
Yeah.
Ear?
Yeah.
Okay.
Yeah.
All right.
Definitely.
That's very interesting to me.
Yeah.
We only have a few minutes left, so I
Oh,
do
man.
have I do have a couple of questions about you because I'm always really intrigued on how someone with your background in traditional medicine made the switch. So what was the light bulb moment for you or the precipitating factors for you to kind of switch your thinking from traditional medicine to what you are doing now, to functional medicine?
I needed a job.
All right. Well,
honestly,
it doesn't have to be big.
It doesn't have to be like this
No.
changing answer, right? Like,
oops, I'm in this field. I can't go back. No, but seriously, I was doing primary care and I was completely bored. And I was looking on Craigslist for a couch. This was before Craigslist got super shady.
yeah.
And I was like, oh, they have a classified on Craigslist. And so the job said, I swear to you, it said for doctors that think outside of the box. And I was like, I'm pretty out there anyway.
Yeah.
This is awesome. And when I started my first job, they were into Lyme disease. And I never looked back. That was really my story. I wasn't a patient. I didn't know about Lyme disease growing up. I had no idea. I told you my experience was the drug seeker. Yeah. And when I went to this practice and I saw these patients who were so sick and struggling at getting better with treatment, I told my husband that day, I said, look, I'm never going back. And my husband, when we were dating, he was already interested in holistic health. He actually taught me more about it, like reading certain books, having certain conversations. He was never impressed that I was a doctor because he felt like herbal was better. And
interesting.
Yeah, he's vegetarian. My kids are vegetarian. I'm not. I'm pescatarian. But anyway, he tried to tell me more about just holistic health. So it's just how it worked out. Like I meet him, we were early in our dating, then a job set for doctors who think outside the box. I really liked him. I said, do you think I should apply? He's like, sure, that's cool. And it was it.
So here's the big question. Did you find your couch on Craigslist?
No,
No.
it was like so
Did you find it? Oh, just kidding.
and
Just being an ass.
stains. I was like, I found a job. I figured when I got this new job,
Yeah.
I would be able to buy a new couch.
Uh-huh.
There you go. There you go.
Okay, so that really for you was the job search led to seeing that and something as simple as outside the box, and you went, hell yeah, I fit that. And you
And then
went
it
for
was like an airplane. It was like, zoom. It was like, got the job. Then I went to another job and I got more patients and they came sicker. Then I met Amen clinics and now I love the brain. So it was just like, I could never turn back to treating traditionally. I could never do it. I love this stuff so much. Like I love it. My family lives holistic lifestyle. I love it. I see the changes, like even with my kids, if grandma comes over, because they're like low sugar, gluten-free, high protein, healthy vegetarians, not those fake ones. But if grandma comes over and gives them those treats, I'm like, why are you fighting? Why are you screaming? Who's kicking who in the face? Like, what is happening?
Oh shit, I hope someone doesn't have pandas.
And no, it's sugar us.
It's sugar.
Sugar us. And then when they stop and they go back to our regular lifestyle, they're back to being sweet. Like you would love them. They'll hug you when they meet you. They're so nice.
They're like Sour Patch Kids with grandma, right?
But when they get that sugar, oh my God. And that's why I tell all my patients, I live this. I see it in front of my face.
Yeah.
When it happens, it's like a light bulb. And then they chill back out when grandma leaves. And
that's the cool part about something you said without using these words, but that example ties into it. We had somebody else as well that came on from Amen Clinic, and he was talking to us about the same thing of there's the treatment part of this, but there's lifestyle change, and you're talking about food, right? And he was kind of saying the same thing, like, yes, we do the scans, we do all these really cool things, but along with that must come nutrition and exercise and nurturing sleep. And all those the pieces to that. And that's a great example because I think that's probably a big, huge piece to this puzzle too, is you have to change your lifestyle to support the interventions here.
And you have to meet patients where they are. That's one thing, because when I first got to functional, I got certified, everyone was gluten-free, dairy-free, sugar-free, ice cubes.
I know, I was like fire hose.
Every single person. They were doing better, but half of them gave up after 2 weeks. So now I've learned it's a barter system. So now I tell my patients, hey, some people who I know are going to be dedicated, they're doing whole only. They're doing that sugar-free, dairy-free. They are hardcore because they've been sick for so long, and the proof is in the pudding. I usually challenge them with like a 3-day detox or a 7-day I try to do realistic things. Or if they're like a PANDAS kid or on the spectrum and they eat chicken nuggets and fries because they have texture issues and food issues, I just tell them, let's creatively try a grape. Let's try vitamins that might just be broccoli, because you got to meet patients. You're not going to win every battle. And sometimes when you give so much pressure to do it right then and there and they fail, that makes them want to give up and lose faith in the process. So I encourage my patients always to have faith, and I pray for my patients all day, because I know it's a long road, but I know the people who get better the fastest are those who have optimal lifestyles. The others, I work with them. One patient told me one day, I was like, what are you going to give up? She was like, I don't know. I was like, what's the worst thing you eat for your brain? She was like, Takis. I was like, boom. Next week, no Takis. Then she started giving me things, and I was like, because if you don't, I'm going to add one more supplement to this list and one more bill to CB. So better than that goes down. That's my barter system. Patients, they react to that because they understand they're going to come back with more and more supplements to compensate for more and more toxic foods.
Yeah.
So But you
Yeah,
can't
and
really do it on a holiday. You try your best, but
it's true. But I do say, like, you can't supplement your way out of a crappy lifestyle
yeah.
either,
Uh-huh.
like, you're just chasing it and it's not
Just
Yeah.
gonna work, but yeah.
Yeah.
This
yeah.
was a great conversation.
Yeah, it
Thank you so much for having
was.
it.
I had so
Yeah.
much fun, guys. This
Yes,
I'm
we'd
just
love
so
to have you
honored.
back, because I know you've got more things to share.
Mhm.
I have
The
so
list
many things. Like it's like a long list in front of me of things you didn't talk about. And I was like, next
Yeah,
time.
I know. We're gonna have to do it.
Yes,
We'll have to do a part. We'll have to do a part 2. I
part
know because
2.
I got about
I'm
5
down.
questions I didn't even ask. I'm like, it's
I
fine.
am down for it. Just let me
By
know.
the way, if you're listening here and you're in just over, this is our first episode of season 2. So
Yeah.
welcome to the first episode of season 2, everybody. So
First episode,
yes,
new year.
new year, new
Yep.
episodes.
Yeah.
So you lead
Yeah.
us off. So you're going to be a tough show to follow. Just so you know, this was a great show. So
Yeah. Well,
yes,
happy new season. I
yes.
can't wait to continue to listen to you guys. Bring the truth. We need you out there. Everyone who's listening needs you. And I mean it. I'm so honored to be here. And we need more like you.
Thank you so
Thank
much.
you.
Thank you. That means a lot.
It
And
does.
if
Thank
you've
you.
hung out with us this far, thank you for listening. And make sure you like, follow, subscribe, give us some stars. We love
Mhm.
all five stars. No
Yeah,
fours,
fill it
just
up. Give us
fives.
some
Yes.
comments. Yeah,
And
give us
make
some
sure
comments.
you share your truth at the Gaslit Truth Podcast at gmail.com.
Thanks, everyone.